Ontario's COVID-19 Science Advisory Table published a new report today titled Critical Care Capacity During the COVID-19 Pandemic. It notes that from the beginning of the pandemic up to the end of October of this year, just over 9,000 Ontarians have been admitted to intensive care units with COVID-19 related critical illness. It also says the critical care system does not currently have capacity to accommodate a surge as it did during waves 2 and 3 due to worsening staffing shortages, healthcare worker burnout, and health system recovery efforts. Public health measures to mitigate influxes of critically ill patients are needed.
This comes on the same day Ontario records a total of 10,000 confirmed deaths caused by COVID-19. To discuss the details of this report, we welcome back to CP24 tonight Dr. Callie Barrett. She's a critical care physician at the University Health Network and a member of the Science Advisory Table. And Dr. Amit Arya, he is the Director at Large at the Canadian Society of Palliative Care Physicians, a lecturer at U of T, and an assistant clinical professor at McMaster University. Thank you both for making time. Dr. Barrett, I want to ask you, you're a co-author of this report. It says at the peak of wave 3, the number of patients on ventilators in this province was over 180% of pre-pandemic historical averages. How did we manage?
It was really a success story, and it was really a coordinated effort between key system stakeholders all over the province, primarily reflecting an approach of using every critical care bed in the province as a whole, and that patients, no matter where they came from, they were going to have access to resources wherever they were available at that point in time in the province. We added new beds. There were 132 new ICU beds that were funded. And then when those weren't enough, we identified surge spaces. And so we surged up into our OR recovery rooms, into wards that could serve as makeshift ICUs. So we really used sort of every possible potential ICU space in our hospitals. But it was really challenging with staffing. And we had to adapt to new staffing models. So we had to use team-based models of care where redeployed nurses who wouldn't normally work in critical care rolled up their sleeves and came down to the ICUs and helped their ICU colleagues out to sort of make sure that there were enough nurses to care for all those additional patients.
Dr. Barrett, if we can just stay with you for a moment here, I want to ask you, what is the current status of our critical care system in Ontario? And what happens if this new variant of concern that everybody's talking about, Omicron, sends more people to hospital?
So, I mean, right now we're doing okay. I mean, the serious concern at this very moment in time is that there's really an acute staffing shortage. So this pandemic has been disproportionately the strain has been felt more by nursing. And so there's a lot of nurses who've left that the burnout was so bad, the exhaustion, the fatigue, and so they left to protect their own mental and physical health. And so we're having difficulty staffing the existing beds and the patients who are in ICUs at present. And so the concern is that if we were to see another huge surge like we saw during the third wave, it would be a lot more difficult. We wouldn't have the same resources in terms of healthcare workers who would be available to look after those patients.
And a labor shortage is a global issue right now, right, Dr. Arya? But when we think about the medical industry, when we think about nursing, as Dr. Barrett mentioned, how critical is it to retain the staff during a pandemic?
Oh, it's absolutely critical. And I'll add that it's not just during a pandemic. I mean, our nursing colleagues are really more frontline than us as physicians, and they're essential to keeping healthcare going. They're the ones who will tell physicians about some change in the patient. They're really the people who we have to be supporting. And unfortunately, we haven't seen that from our government and, through the policies that have been enacted. I mean, when we're speaking about nurses, I think about Bill 124, which is wage suppression legislation for nurses, where their wage increases are capped and actually are less than the cost of living, effectively actually giving nurses a pay cut during the pandemic. I also think about, as Dr. Barrett has mentioned, there's a lot of, emotional suffering and grief that all health workers have experienced and seen through this pandemic. Working with very sick patients, such as those who have COVID-19, is not easy. And we don't have, mental health supports for the trauma that people have experienced. So, of course, I mean, people are just going to leave the profession.
So, Dr. Barrett, the Ontario Science Table is asking for the province to implement a number of public health measures to protect hospitals from an influx of COVID patients. What kind of measures are you looking for?
So we didn't specifically ask for specific new measures. What we really wanted to make clear was that we need to continue to use the public health measures that have been working so well. We're actually doing really well in Ontario when you compare us to our peer jurisdictions, and that's due to our really our high coverage of vaccines, our adherence and our continued use of masking in indoor spaces, focusing on ventilation and making sure that air quality and ventilation and filtration is optimized as much as possible. And so this is not the time to be relaxing those measures. And when we look at the fact that there are also additional risks right now, given the time of year, seasonal influenza, RSV for the pediatric populations, those are potential concerns for us. And then we really don't know yet enough about the Omicron variant. So I think it's too soon to say. But if that turns out to be a variant that has a really impactful effect on hospital and ICU numbers of patients in hospital and ICU, then that could be very concerning for us.
Dr. Arya, where are the fractures then in our system where these potential threats could get through?
Yeah, so I think right now, just as Dr. Barrett has said, I mean, we are doing well on certain fronts. But one thing that, I always think about is we need a vaccine mandate for all health workers. We need a vaccine mandate for education workers. That's something that we're still lacking. And I think we could do more, much more, actually, to recognize airborne transmission of COVID-19. I mean, we're so far into the pandemic, and we know that this is clearly the case, but we haven't seen this recognized by our public health units and our governments. And just today, I can share with you that I was speaking to a colleague who's working at a health facility with a COVID-19 outbreak, and they called their local public health unit, who actually told them, or actually recommended not to use N95 masks. And that's, honestly, it's absolutely absurd at this point in time. We should be encouraging use of N95 masks, definitely in healthcare and in many other settings, improving ventilation and filtration, as Dr. Barrett has said. And I think rapid testing is another tool that we can also use. I know Nova Scotia has provided families with rapid tests for free. Ontario has, from what I understand, 20 million rapid tests lying around somewhere. Now is the time to distribute them and use them as an effective public health measure to hopefully reduce the transmission of COVID-19.
Dr. Arya, 10,000 people in this province have died from COVID-19. 10,000. That's a sobering statistic. What's running through your mind as you think about that number and all of the families who'll never be the same?
Well, I mean, it's hard to put into words, what I feel when I hear those numbers. It's kind of something that I feel numb, to be honest, when I hear. And I've, like many of my colleagues, like Dr. Barrett, we've witnessed a lot of unnecessary suffering, a lot of unnecessary trauma through this pandemic. I mean, I've worked in long-term care facilities, which have had large-scale COVID-19 outbreaks, where once again, these outbreaks actually didn't need to happen. I've worked in Peel Region through a lot of the third wave, where I saw, or in fact, I would say almost everyone that I saw was either, an essential worker or a family member of an essential worker who was getting sick with COVID-19. So I really think now, once again, it's never too late. I think now is the time for our government to take action and recognize that a lot of the suffering and death from COVID-19 is preventable. We need a lot more investment, of course, into our healthcare workforce, as we've talked about, especially when we talk about our nursing colleagues. We can repeal Bill 124. We can provide 10 permanent paid sick days. And of course, we need to recognize airborne transmission of COVID-19 as well.
Dr. Barrett, are you seeing any efforts on the health system recovery front at this point?
Well, the Ontario Health sort of roadmap for the next several months very clearly lays out that there really has to be a prioritization of COVID and non-COVID activity. We can't let non-COVID patients, their procedures and their care be deferred or delayed. So in terms of recovery, I think that care deficit is certainly a huge concern for the health system leaders as we move forward. But I think we're, to be honest with you, I think we're still very much in the throes of this pandemic, and we're not really out yet. And so I think we're a ways away from truly the full recovery. We're not there yet. We're not out of this pandemic.
All right, we'll leave it there. Dr. Kelly Barrett and Dr. Amit Arya, thank you both for making time for CP24 tonight.
Thanks so much.